We're in this together, an update on COVID-19.
I'm Liz Walker, the Public Relations Coordinator for AnMed Health, and here with me is Bill Manson, the CEO of AnMed Health. Let's first talk about telemedicine. It is on everybody's mind. What is it? How does it work? And why is it so important during this pandemic?
COVID-19 really brought about a whole new set of issues for both the public and for us. And so in the space of really 1 week, our physician network team developed an entire new set of telehealth services to allow patients to access our providers. MyChart is part of the Epic system so that patients could interact with their providers through MyChart. It also included phone visits where patients could actually call in, schedule a time and call into a provider for their visit. And third, we added video visits where patients could use their phone or their portable device if they had video capabilities on that device to interact directly with a provider at our sites. In the space of 1 week, we did almost 8,000 of those visits. So it was a huge, huge thing for our providers and for our patients to be able to access care without the physical contact that usually comes with a physician office visit.
So telemedicine is really important right now. Also, people donating blood, that's very important as well.
Donating blood is always important. The added element here, we, along with several other hospitals across the country, are part of a research trial that's being conducted by the Mayo Clinic. And that research trial uses the plasma from patients who have recovered from COVID-19 to transfuse into patients who are very sick with COVID-19 in order to try to provide them with antibodies to fight their disease. We have actually already treated several patients using this plasma process, and so we are trying to encourage any patients in our community who have recovered from COVID-19 to donate blood so that we may recover the plasma and treat other patients with it.
Fantastic. And I know that even though the governor has relaxed, the stay-at-home order and people are going out and businesses are opening up, it's important to still be very careful.
Yes, from our perspective, because we see the worst part of this disease. We see patients who get very, very sick, need to be admitted to the hospital, sometimes end up on ventilators, and are some of the statistics, unfortunately, of folks who have died from COVID-19. We think it's absolutely critical that people continue to do all the things that we have been talking about for the last 6 or 8 weeks, that they be very careful about hygiene and wash their hands and use hand sanitizer on a regular basis, that if they have a cough or a sneeze, that they do that in their elbow as opposed to exposing the folks who are around them, that they social distance when they're out in public, that they wear a mask whenever they can do that, so that they minimize their exposure and others' exposure because this disease is still in our communities.
And the community has been reacting so wonderfully with donations. I mean, it's just amazing to see the donations.
It's been truly rewarding and remarkable. We've had so many people in the community support us and our employees in so many ways, whether it's through donation of equipment, whether it's through meals for our staff, whether it's through letters and cards just thanking our staff for taking care of these COVID patients. It has truly been remarkable. Follow us on Facebook for a full listing of this week's donations.
We're in this together, an update on COVID-19.